What has to be one of the most bizarre side effects to any medication, albeit some people, believe it or not, suffer from this condition, or syndrome I should say, naturally, is something called Cotard's syndrome. The side effect, or I should say the medication that most often causes a side effect, is actually a cold sore cream. But let's look at it, and keep in mind too, the people that suffer or are suffering from the side effect or suffer from this condition naturally, it literally has to be a nightmare that's of unimaginable proportion. But let's look right into the public release title, and I'm not making this title up. The title of the public release was called The Cold Sore Cream That Makes You Think You're a Corpse. And this is a common cold sore cream called acyclovir. Albeit, the side effects or chance of this occurring are rare, 1% of the people that use this medication will suffer some sort of neurological condition or side effect as a result of it. But the cold sore cream that makes you think you're a corpse, other medical terms for Cotard syndrome, literally, verbatim, without exaggeration, is walking dead syndrome, or about to look at one of the titles from 2007 from one of the citation releases, death delusion. In fact, let's do that right now. All right, citation title, Death Delusion, first one published, British Medical Journal in 2007. I'm going to refer to another one from 2013, albeit they're all going to stand true regardless of the time period. The other one called Mentioned Cotard Syndrome as an Adverse Effect of Acyclovir Treatment in Renal Failure. Yeah, remember, people with kidney issues are going to be more prone to this rare side effect than those without, because it has to do something with clearing a metabolite of acyclovir out of the body. Funding for the original study, Death Delusion, in 2007, on a restricted grant from GlaxoSmithKline. Dosage, this usually occurred at about 1 to 3 grams orally of acyclovir. Results, this explains kind of how it does this type of damage, as well as how often it occurs. About 1% of the people who use this drug, or cold sore cream orally, or cold sore drug I should say, not cream, will experience some psychiatric effects. To me, 1% of 1 out of 100 is still pretty darn high, including Cotard's, most likely due to acyclovir's main metabolite, otherwise known as 9-carboxymethoxymethylguanine. Otherwise, for short, we'll call it CMMG for now. Pharmacologists have discovered one of the mechanisms, this is kind of how it does its nasty job, that triggers Cotard syndrome, a condition causing people to feel as if they have died, which I never would have guessed there was such a feeling, or parts of the bodies are dead or no longer exist. People in the grip of Cotard's delusion can also believe they have lost their blood and internal organs, such as the brain, and cannot respond to any rational reasoning with them that they are in fact alive. Zombie-like? Sure sounds like it. However, keep in mind, not to make jokes about it, the people that suffer from this, it has to be literally a nightmare. But to move forward, this is kind of what happens to give you an idea so you can relate. In rare, but it happens, there exists that rare psychological disorder called Cotard syndrome, as we discussed. And patients with no history of mental problems who use the drug acyclovir to treat cold sores, herpes, shingles, chickenpox started demonstrating symptoms of Cotard's. What they do is they speculate that this chemical is metabolite of acyclovir called CMMG, which obviously if they inject it into a person directly is going to be the only way to find out if it's actually it or not, which would be scary on its own, might constrict blood flow in the brain, which in turn might interfere with ordinary brain functions to the point of delusion. Case example, a patient taking acyclovir to treat shingles went to the emergency room in a state of high anxiety because she strongly feared that she was dead. After a few hours, her symptoms alleviated enough that she decided that she was alive after all, except for her left arm, which she insisted did not belong to her. You get the drift. Yet within 24 hours of her hospital visits, all such delusions had completely vanished. What they did is they lowered that CMMG metabolite down out of the bloodstream, and that in turn helped to return to normal. The cure for CMMG-induced death delusion is simply, as I just said, to lower the levels of 9-carboxymethoxymethylguanine in the blood However, keep in mind it's still scary just the same, even if just to experience for a few moments. So, in question, what is the most bizarre side effect to a medication, especially a common cold sore cream of all things? Is Cotard syndrome. Walking dead syndrome or death's delusion, whatever you want to call it. It's scary just the same. Again, hope I answered that question for you. This is Ralph Turchiano signing off, and I'll see you all once again in 7 days. See you then. Bye.